everyone, my name is Whitney and I am a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Let's talk about how to nail your RDH job interview. And before we jump in, I'd like to quickly remind you about my career hub on teethtalkgirl.com/RDH, made just for you, all about the career of dental hygiene. So whether you just graduated dental hygiene school or you're looking to pick up a part-time gig, it's just a time for change in your full-time career. There are a lot of opportunities out there for dental hygienists right now. So as you're beginning your job hunt, you want to have your RDH job interview questions for the office just as much as they do for you, and we'll go over those in just a moment. But to start, it's super important to mention how one of the fairly common things we've seen in the dental management community is an increase in ghosting, aka people not showing up for their interviews or never returning calls. So first and foremost is to show up. Communicate. If they call you, call them back. If they want to interview you, say yes or no if you'll be there. That's the easiest first thing to do, and it's so wild how many people don't. So having said that, the most important parts of your interview are to 1, be on time, communicate, all that stuff we just said. 2, dress professionally. It's usually not recommended to wear scrubs for an interview. It's good to wear your professional clothes. And 3, have your own RDH job interview questions lined up for the dentist and or the office manager. Having a list of these RDH job interview questions will help you get the information you need without forgetting to ask about certain things that are important to you. Plus, asking questions shows that you've genuinely thought through the hiring process and what it would mean to be a part of their team. The interviewing process is just as much about you interviewing them as a potential employer and work environment as it is for them interviewing you for the job. It's a two-way street. That's something lots of us tend to forget because we're always so focused about getting the job, right? But going into it knowing you're not even sure if you want the job yet can really help you feel more confident. Well thought out questions from you also help provide the dentist or hiring manager with some insight as to your scope of care and your work ethic. You want to be able to have a great job, not just for source of income, but also to hold the same values as you do for their patients. And before we go over these 12 RDH job interview questions, please remember that you do not have to ask all of these. Just whichever ones feel right to you and feel important to you. By the way, it doesn't hurt to have these questions typed out and on hand along with your extra resume. You may find that several of these questions are naturally explained as part of the typical back and forth conversing during your interview. And remember that nothing is worse than asking one of these questions when they literally just explain the answer to it already. So make sure you're paying attention. That's just really a tip for basic human conversation. But sometimes basic conversation is stressful when you're at a job interview. You might forget to pay attention. So it's worth keeping that in mind. Also, all of these questions are listed on teethtalkgirl.com/RDH on my career hub, which I will link them in the bottom bar below. Okay, number 1, how are the hygiene appointments scheduled for new patients, SRPs, and recalls? If you're a hygienist, you know that time matters. Does the office provide ample time to perform all of the job duties you're responsible for? If a new patient appointment requires an FMX, full mouth probe, exam, and a prophy, you'll need to know if you'll have all the time to do it properly. 2, how long has most of your staff been here? A high staff turnover rate could be a telltale sign of bad management. On the other hand, long-term staff retention is a great way to get a read on job satisfaction and harmony within the practice. When in doubt, always listen to your gut. 3, what type of annual training do you offer to the full-time versus part-time staff, depending on which applies to you? This is a great question because it covers everything from CPR and HIPAA to your required CEUs each year. Maybe they take everyone to a dental convention each year or host a lunch and learn every month. Lots of RDH jobs do include CE training as a perk, but part-time positions may not. Also, be sure to find out whether any training is mandatory for the part-time staff, and if it is, if it's conducted on days that fall within your normal work schedule or not. And these next two, number 4 and number 5, go together. Number 4, does the practice have any plans for growth, such as changes in their operating hours or adding an associate? And 5, understanding why the office is hiring a new hygienist is vital to your short and long-term job satisfaction. Is the old RDH retiring? Are they simply adding an op to make up for practice growth? Or is there something bigger to consider, like a new dentist coming in or something that might catch you off guard? You might love the current doctor, but if they're hiring an associate or merging with another practice, you want to consider how the other dentist fits into your overall vision. 6, what type of instruments and equipment does the office use? We all know that worn out scalers can only do so much. An office that's well equipped with the right hygiene equipment will help you do a better job without excessive physical strain. Be sure to check out everything from the ultrasonic to the hand scalers and any imaging equipment. 7. Do you find that you're able to stay on schedule for the most part? Some offices are notorious for running behind, especially if they're high volume or have shorter appointment times. And while you're on the topic, try to find out what time the hygienist leaves each day to go home. This can help you realistically decide as to whether or not you can meet other commitments. 8. What's the process of having the dentist step in for an exam? This is something I wish I would have asked. It's such a simple question. And then when you start your first day, you already know what to do. When it's time for the exam, you're not like, uh-oh, what do I do? So just ask, does the dentist usually come in when they have a stopping point in their current procedure, or do they wait until you're completely finished with what you're doing? Can't hurt to ask, just to know. Number 9, how does the dentist prefer you to share your findings with him or her? Every dentist is different. Some want a post-it note with what you found during the prophy. Others don't mind if you just talk about it out loud. Some even prefer that you prep the patient for a suspected treatment need before they step into the room. As you find the right balance for that particular dentist, it will help you find your fit into the office's patient care routine. 10. Can I have a quick tour of the office? As you're walking through the office, look for things such as cleanliness, organization in the sterilization area, equipment that's on hand, and observe the interactions between the staff and the patients. Are people stressed and short-tempered or pleasant and happy? 11. What happens if there's an emergency and the dentist or the hygienist can't make it to work? Do you get a temp? Reschedule patients? What happens in those rare situations? Life happens. If you wake up with a stomach bug one day, will it be your job to call a temp hygienist, or does the office prefer to reschedule all of your patients for another day? Also, consider some offices close when the dentist goes out of town for vacation. You might prefer to continue working and see established patients, or temping that week if you know ahead of time. If you're not able to stay, things to think about. Again, I can't stress enough, if any of these feel weird or are not flowing with the vibe, you do not have to ask all of them or any of them. Maybe they will tell you all of this information beforehand, right? So just reminding you that again, that all of these examples are just examples and ideas for you. And finally, number 12, before you accept any job offer, I think it's worth asking if you can schedule a working interview, especially if there are any contracts involved. You can simply say, I'd just really like to see how we can fit together and be sure we're all on the same page before I accept the offer. On the other hand, it's not a bad thing to get hired on the spot, but if you have options and you want to make sure this is a smart long-term move in your career, ask for the working interview. That means showing up on a separate day in scrubs, seeing patients, and getting a first-hand view of all the ins and outs of how their office flows. I personally got hired on the spot and it worked out for me. It felt good. I didn't feel like I needed to request a working interview. I did go in one day and shadow one of the hygienists to learn where they store everything in the cabinets and drawers and stuff, which was super helpful. But either way, some people prefer a full working interview where they can really feel out the office vibe. Totally up to you. If you want to learn more about how to answer common interview questions that the dentist or hiring manager will ask you, I have a video all about that, which I will link in the bottom row below. I will also link my how to avoid a toxic workplace video, which is super helpful if you're interviewing or looking to switch offices. I hope this video helped you. Please like and subscribe if it did. And until next time, peace, love, and teeth.